As Jeremy walks in to get his booster today, he's keen to make sure he's protected. A race has begun once again between the virus and the vaccine. This time last year, it was first COVID jabs being queued for. Now with the Omicron variant, it's 3.
How important do you feel it is for you to get the booster?
Very.
Why?
Why would... I don't understand why anybody wouldn't. It's just I'd rather have an injection than be ill.
At the Solent NHS Trust Vaccine Hub, there had been a lull over the last few weeks, but after the message from Boris Johnson yesterday, it's been very busy.
So we opened at 8 o'clock this morning.
And when will you be finishing?
And we'll finish at 8 o'clock tonight.
We're seeing that some people have been finding it difficult to get in and get schedules and get boosters. What would you say to people who are worried about that and worried that they might not be able to get theirs?
So I think I would encourage them to be patient, be kind to our staff. They're doing absolutely everything they can. We're putting more and more capacity on every day, so you will get the opportunity to get your vaccine.
Well, the message from the Prime Minister seemingly going out loud and clear that booster jabs are needed now. This vaccination centre has been really busy, but you are not just allowed to rock up. You do have to have an appointment first, and some staff say that people have been upset by that. Also, those who are wanting to book online, there have been issues with that as well on the NHS website too, and a separate issue with lateral flow tests. So some people say they've been trying to do the right thing, but haven't been able to.
Queues here in Southampton, but also elsewhere in England. In Oxford, walk-in appointments were being turned away. In London, at St Thomas's Vaccine Centre, the wait to get a booster here, some say 5 hours. The slogan of "Get boosted now," in practice turning out to be, you might have to wait a while. Down the road at another hub, the Prime Minister set out the latest variant figures.
We can see Omicron spiking now in London and some other parts of the country. Here in the capital, it probably represents about 40% of the cases. By tomorrow, it'll be the majority of the cases, and it's increasing the whole time.
Tonight, the opposition leader Keir Starmer is giving an address to the nation too.
And personally, I want to urge every one of you to book an appointment or go to a walk-in centre as soon as you can. If you haven't had your first or second jab, now is the time to come forward. It matters more than ever.
And in Wales, another televised address, this time from the First Minister.
We have to be prepared for cases to rise quickly and very steeply, just as they have in other parts of the UK. And we're likely to need to take more steps to keep Wales safe.
The warning from all that the dangers of the Omicron variant, while not fully known, cannot be underestimated. The booster is said to offer good protection, but what about those who haven't had a vaccination at all, with COVID patients in intensive care, now almost all unvaccinated?
What would be your message to someone who is still unvaccinated, who doesn't want to go through with it and just isn't convinced by anything they're seeing on telly at the moment?
The vaccine has demonstrated worldwide this safe and efficacious. The one thing I would suggest to anybody is that this is the single best way you can do to get your own and everybody else's life around you back to normal as quick as possible.
With the Health Secretary telling MPs that the Omicron variant now accounts for 20% of COVID cases, the vaccine rollout will need to step up and fast. Ambitious targets will have to turn into action.
Well, I've been speaking with the chair of the British Medical Association Council, Dr. Chan Nagpal. I began by asking him how many people actually had the necessary 2 vaccines to qualify for the booster vaccine.
It's correct that the government is pulling out all the stops to try and get all of those who have had 2 vaccinations to receive the booster, because we know that being double vaccinated does not confer protection against the new variant. However, it's also important to recognise that we believe millions, if not about 1 in 4 adults above the age of 18, will not yet be eligible for a booster because they've either not received a vaccination thus far, or they've received one or the second in less than 3 months ago. And so it's not as if we're going to enter the new year with the entire population protected, even if we were to get everyone who's eligible for a booster to receive it.
Let me ask you, therefore, the $100 question. How are GPs coping?
Well, GPs are absolutely exhausted. They're seeing demand at higher levels than before the pandemic, about 2 million extra patient contacts in a single month. They're now being asked to be embarking on the greatest vaccine program we've ever had to deal with in terms of the numbers that we're being expected to vaccinate in a very short space of time. The trouble is something has to give. And the government has said that in order to create the capacity for the vaccination boosters, routine services will need to be suspended, some routine services. Now, clearly, we as GPs want to make sure we are there for patients who need us. But the trouble is, we can't do everything at once. So this is a very difficult time for us.
Are you personally cancelling routine services?
No, at the moment, I mean, the announcement was only yesterday, so we haven't cancelled routine services. But as we begin to start to be involved actively in vaccinating, as our staff start to spend their time in vaccination centres and GPs spend their time in vaccinating, they clearly can't be at the same time running their practices in the way they were before. What we must make sure is that patients who need urgent services of general practice are able to be treated and seen, and we will do everything we can to make sure that happens.
But then the reality must be that people who are not in fact suffering from the virus but actually have other very serious medical conditions may die as a result of this policy.
I think we have to make sure that the vaccination program is in tandem with ensuring that those who are clinically in need of seeing a doctor, being treated, continue to do so. What we must not do is result in patients without COVID suffering needlessly. We had 12,000 excess deaths last year due to a halt on routine services. We must learn from that and make sure we prioritize those